Hi, my name is Pete Johnson, and I'm going to explain how to perform the single leg star balance excursion test. Now, this test measures dynamic balance and effectiveness of the neuromuscular system in the lower extremities, and it also assesses range of motion in the lower extremities and the joints in the lower extremities as well. To perform this test, I'm going to stand right on this starting point here, okay? And I have 8 markers, as you can see. Okay, I have 8 lines that are spread out here, and each line, there's a 45-degree angle in between each line marker. Okay, it almost looks like a wheel without the rim. Almost looks like a wheel without the rim. And so you're going to want to start at this starting point here. Now, if I were to test my left leg, okay, I would keep my left leg planted on the floor like so. Okay. To start out, you want to bend down with your left knee as far as you can go while keeping balance. Okay, your knee should still be aligned with your body. Okay, and I'm going to reach out anteriorly with my right leg. I'm going to tap on the marker as far out as I can. I'm going to reach out anterior-medially with my right leg, medially, posterior-medial, posterior, posterior-lateral, laterally, anterior-laterally, and back to anterior. Now, when I'm testing my left leg, it would be anterior because I'm moving in a forward direction. This would be moving in the sagittal plane. I'm moving anteriorly, posteriorly in the sagittal plane. In the frontal plane, I would be moving medially with my right leg because my right coxal joint would be moving inward towards the midline of my body. So I would be moving medially. And if I were to test my right leg moving laterally, my coxal joint on the right side would be moving outwardly, exteriorly, away from the midline. So I would be moving laterally. And that medial lateral movement would be in the frontal plane. Now, the anterior medial and the posterior medial would be moving in the transverse plane. And that would be moving in the forward direction, and I would be moving my coxal joint in towards the midline, would be anterior medial. I would be moving backwards, and my coxal joint would be moving in towards the midline, which would be posterior medial. I would be moving my right coxal joint away from the midline and behind me, which would be posterior lateral. And I would be moving my coxal joint away from the midline and forward, which would be anterior lateral. Okay? If I were to test my left leg, I would stand with my right leg planted on the ground. I would bend my right knee as far down as I can while keeping it in center in line with the rest of my body. And I would move anteriorly, anterior-medial, because my left coxal joint would be moving inwardly towards the midline of my body. I would be moving medially, posterior-medial, posteriorly, posterior-lateral, laterally, anterior-laterally. Okay? There's common faults associated with this test, and I'll explain them right now. Number 1, if I were to extend out with my leg, if I were to tap too hard on a point, that would be one common fault associated with this test. Another common fault associated with this test is if you were to reach out and hold my leg here, hold my foot here, take a rest for a few seconds and then bring it back to the midline. That would be another common fault. A third common fault is if I go to reach my leg out and I lose my balance, would be a third common fault before the experimenter has time to record the results. And then a fourth common fault would be is if I did not bend my knee far enough, if I was in an upward position, if I did not bend my testing leg down far enough, would be another fault of this test. Now there are two ways to perform this test. One would be to objectively assess how far I can extend each leg while keeping it balanced. I would have an experimenter record the results. So for example, if I were testing my left leg, or if I was testing my right leg, excuse me, I would bend my right knee down as far as I can go while keeping it in line with my body, and I would extend my left leg out as the experimenter recorded the results, and I would do that for 8 different points, all 8 of the points, multiple times to get a proper assessment. And another way you can perform this test is if, let's say, an athlete was just coming off of an injury and they wanted to improve their balance. This would be a great test for them to perform to try and increase their flexibility in their lower extremities and increase their balance. Some pros and cons that are associated with this test. Some pros are that it's easy to set up. All I did was measured out my yarn. You can use yarn or athletic tape. And measured out my yarn. Typically you'd want 6 to 8 feet per strand, so that would be 4 lengths that are 6 to 8 feet, and that's all the equipment that you need for this assessment. Another pro to this assessment would be that it is very valuable or very valid, and medical professionals can use this assessment on their athletes or their patients in rehab. Another pro to this test would be that it is inexpensive, very inexpensive to use. Some cons to this test, however, would be that you have to do the assessments multiple times, meaning that I would have to perform the balancing, I would have to perform the toe taps on each different point multiple times before I started testing. And that could be very time consuming. And another con to this test would be that numerous practice trials should be performed before you record your results to this test. And a third common fault would be that the performer and the experimenter might have different opinions as to whether you performed the toe tap properly or there was a fault in your toe tap and that toe tap needed to be voided and you had to restart the whole process. So there could be some confusion between the performer and the experimenter in how the test is performed, so there might be multiple trials that you might have to encounter because of that. And this is the STAR single leg balance excursion test, and I hope you learned a lot from this video, and thank you for your time.